right. Well, maybe in the sake of time, then we'll get started. My name is John Grotus. I'm with MnDOT Project Manager, and welcome to everybody here. It's a little bit awkward, obviously, this year, but I would like to introduce the panelist for the transit system safety, and it's all about safety here. So it goes till 4 p.m. I'm not sure if it'll take that long, but that's what the scheduled time is. And I'd like to introduce our panelists today, and they're going to go in the order of what the program listing is. And we have Bill Maroney and T.J. Doyle with APTA, and Scott Stark with St. Cloud Metrobus. And then we also have Captain, I believe, Brooke Blakely with Metro Transit Police, and I'm going to let them all do just a short bio because I don't have anything here, and so I'll let them just go that, and we'll just go in the order if they of their names that in the program. Obviously, if you have questions, please raise your hand, and we'll just see how it goes if we. Depending on the timing when we ask the question. But anyway, if you wouldn't mind introducing yourself, Bill, and we'll go from there. Thank you.
Great. Thanks, John. And thank all of you for participating this afternoon. TJ and I, we both work in the communications and marketing department. I have been associated with APTA, the American Public Transportation Association, since 2001 as a public relations consultant, and then later as a writer. One of the things that I'm responsible for at APTA is the annual report. And we always put the message in the annual report that APTA speaks for the industry in North America, that we are the voice of public transportation. And so with that in mind, the APTA chair, Nuria Fernandez, created a task force to look at what needed to be done during the pandemic and after the pandemic. TJ and I worked on the aspect of how do we get riders back and tell our story. And that really has been on the minds of every transit agency. It's the question we most often heard in the spring and early summer. How do we protect our riders and our employees? And how do we win back the confidence of riders? So to answer that question, we did something rather novel, and that is we went to the riders and we asked our passengers what it is that they wanted to see, feel, smell, touch, that would give them confidence in riding public transportation again. And we did some rather thorough research, knowing that a number of public transit agencies around the country were doing their own local public opinion research. We first looked at what they had done. And then we launched our own research at the national level. So I'm going to begin with the slide presentation. Unless TJ, do you want to pull it up?
I will do that. 1 second.
Great. So before I begin, I want to tell you that we will make these slides available to you. There's a lot of data here. There's a lot of information. And I don't want you to feel you've got to take copious notes here. So you'll have access to this presentation. The first slide that I'm going to show here, we looked at how the pandemic has disrupted public transportation. And after we did an assessment of what local transit agencies were finding in their communities, we did two things, two kinds of research. The first, it's called Brightboard Objectives. It was really focus groups in 15 different transit-friendly markets with large, medium, and small-sized transit systems, some with mostly bus, some with mostly rail, some with multimodal. And these 15 focus groups across 15 different markets they met online for 3 consecutive days so that we had a real exchange of ideas, a real conversation that evolved over those 3 days. The next thing we did was we did a very large national survey with over 2,000 participants. And that's what I'm going to present here today. Because what we found in the focus groups in the 15 markets and what we found with the national survey meshed perfectly. So as I go on to the next slide, we found that starting out that if people had used public transportation during the pandemic, they actually had a very positive experience to report. And it was positive regardless of mode. Ridership varied greatly among modes, with bus passengers being most likely to return, light rail, commuter rail being the least likely to return. But if people tried it, they liked it. They were impressed with what they saw. So you can see some pretty impressive numbers here. If you look at the people who had a good or excellent experience, it's in all of these, it's well above 50%. And if you look at all 3 top categories, it's 90%. When we asked people why they weren't returning to public transportation, part of it was that they had no place to go. Their workplaces were shut down, stores, events were shut down, but 6 out of 10 did report that they were worried about either catching or spreading COVID. So that was a rather significant piece of information. It wasn't just the fact that people didn't have a destination. It was also that people were saying that a majority were clearly concerned. About half said that they were comfortable using public transportation in the near term, meaning that in the coming weeks, they felt comfortable returning. And again, you'll see the difference between among the small, medium, and large systems, and among bus, rail, and multimodal. The multimodal people were most likely to say they would return, and the medium-size systems also reported some of the highest numbers, and the small did too, with people who really knew their communities and knew their systems. So as we look at ahead to the future, we asked folks, did they foresee returning to transit in the coming months? And again, there's a little bit of good news here. The numbers are not huge, but in every category, large, medium, small, bus, rail, multimodal, folks reported that yes, by some measure, 2% to 7 or 8%, in one case 11%, they did plan to return to public transportation in the coming months. And this was really a reflection on people believing that the situation was going to get better and that transit was going to become safer. So we took that information and we as a starting point, and then really wanted to know, what did riders say they wanted? And when we look at this chart, you can see that the top 3 categories that we found, 56%, 61%, people were saying, number one, they wanted to know that it was a safe option for them. Number 2, they wanted to know if their public transportation system and vehicle was clean. And they also said something that surprised us. They said that they wanted to be able to social distance, and it was the way they expressed it, that they wanted the ability to take some responsibility for themselves to be able to social distance. The 4th item also popped up above the 50% mark, and that was they talked about ventilation. Were the vehicles and stations going to be well ventilated? Riders agreed that COVID-19 safety is a cooperative effort. And this was very heartening to the task force because it told us that riders didn't view this as the sole responsibility of public transportation professionals and systems. They felt by a pretty big margin that they had a role in keeping public transit safe. So if you look at those top three categories, safety on public transportation has to be a cooperative effort between systems and riders. That came in the highest at 62%. I want to know that public transportation systems are enforcing the COVID-19 related policies that they've put in place. And then the third highest ranking was, I want to feel empowered to make the safest choices when I ride public transportation. So that third one, again, people wanted to have some power over the decisions they were making over their own safety. And that really got us into a whole discussion about information. In order to make safe choices, riders want more information. The other thing we found was that it was very reassuring for riders to see some kind of safety certificate or seal. They felt that if systems had some way of showing that they were meeting some kind of standards or commitments, that would go a long way to reassuring them. And you can see that that first bar, the total bar, 87% said that they would be very reassured or extremely reassured by seeing some kind of certificate or seal of safety. And we tested that notion before and after, and those green triangles indicate the change in attitude between the before and after. And in the world of public opinion research, those are very, very big numbers. The difference between how people felt about the health and safety of transit before we talked about a seal, and then how they felt about it when we said if there were a seal to show that certain standards or commitments were being met, how would you feel? And so you see the jump in positive attitudes, 11%, 10%, 12%, 13%. And again, you see it in small, medium, large systems. You see it across modalities. So that told us a lot right there. So I'm going to recap quickly here. In both the 15 focus group markets and in the national survey of over 2,000 respondents from around the country, we found an overwhelming majority, 81%, said that cleaning and sanitizing and some kind of safety seal, those were the two things that would do the most to increase their comfort in riding transit. They also said that, to break that down, they said that key actions that would win them back would include some combination of requiring face coverings or PPE for both riders and employees, detailed and frequent cleaning, and they didn't need to necessarily see the detailed and frequent cleaning. They just needed to know that it was being done. And then the third category was ventilation, capacity limits, frequent onboard rider reminders about the rules, a seal of approval. So there was a mix that came in there in terms of what would win them back. A majority agree that COVID-19 safety is a cooperative effort, and having more information empowers riders to make the best choices when using transit. And overall, safety messages, being able to see posters, reminders, a safety seal, understanding what public transportation agencies were doing in their local community, that also increased their comfort level. So the more that agencies communicated to riders, the more confident riders would be in using transit. It's a simple concept, sounds like just common sense, but we often forget how important it is to communicate, and TJ and I are in the communication business. So I'm going to show this. this slide that kind of summarizes a number of the much of the feedback that we got. And you can see in the left-hand column, it's broken down by bus, large, medium, small, and then rail, large, medium, small systems. And we asked folks, what would be the number one action that would win you back? And there you see the number one action in any system that riders told us was to require face coverings and some kind of PPE. The second one, overwhelmingly, was that employees would be required to wear face coverings and would be screened for health. They wanted to make sure that transit employees were healthy. And then the third, when we expanded to say, okay, what would be the three things? Then you begin to see some other ideas coming in. Frequent cleaning, disinfecting, the use of hand sanitizers, ventilation pops up a couple of times, reduced contact with operators. And then when we went to four, tell us the four actions, then you see some more variety here. Capacity limits, being able to see a seal of approval that tells you that there are standards being met, frequent reminders. And then when we expanded it to tell us the five actions, then we got even more ideas that were popping up. But you can see that they're all pretty much in the same family. It's all about protecting yourself as a rider, protecting transit employees with PPE. It's about cleaning, disinfecting. It's about communication. It's about physical distancing, said in different ways. So we took all that information and we said to ourselves, we need to distill this into a simple, understandable, easy to digest communication for what public transportation systems need to address and what riders need to do. And we need to do it. We need to do it in a way that allows any public transportation industry agency anywhere in the country, whether it's large, medium, or small, whether it's regardless of what kind of resources it has, regardless of its ridership. We needed to do this in a way that allowed any public transportation agency to meet these commitments, to show riders what they were doing and to tell riders what they expected of them. So TJ, do you want to pick it up here and tell us what
Thank you, Bill. As Bill noted, I work in the comms shop with Bill. I'm the Director of Advocacy Communications, and all of the research Bill just went through is the foundation for this Health and Safety Commitments Program. And as we talked about, we wanted to do something at the industry level, at the 30,000-foot level, because we saw a lot of different systems were doing different programs that had elements of this. And if we could create something that was both able to augment and amplify what they're doing, but also give some agencies and systems that perhaps haven't had a chance to do some of these programs, they can use what we've created for themselves and their communities. So the four tenets of the Commitments Program are all based on the research you saw. It's following official guidelines from local, state, CDC sources. It's protecting each other, and that carry through of this cooperative effort is key. It's what are agencies doing by cleaning and disinfecting their vehicles? What are they doing by arming their operators with PPE? But also, what are you as the rider doing before you come and hop on the bus or the train? Keeping passengers informed through informed choices. The more information we can provide to riders, the more comfortable they're going to feel. And this whole notion of they're going to ride when they feel comfortable, this is us setting the groundwork for them to come back when they're ready to come back. And then the biggest sort of communal aspect to this is putting the health first of agency employees, system employees, and also the Joe and Jane rider, so that everyone knows that they're going into an environment where everyone's trying their best to mitigate any sort of health or safety issues. We created a broad commitments chart. It's going to be difficult to read on the screen, I'm sure. I'm going to give you a link later on that has all of the toolkit resources we're describing. But the two columns are important here. It's the commitment those that pledge to the program are making to riders, but it's also what riders are committed to doing as being part of this cooperative effort. And it breaks it down into the four categories I talked about. It has very clear, distinct color coding and iconography that, as you see as we move along, we're able to break the commitments program down into sort of 4 tenets or 4 tiers. So if you want to talk about cleaning and disinfecting in a social media post or a newsletter you're doing, you can pull that piece out and highlight that piece. And again, you can talk about it from your agency or system perspective, and then you can talk about it from the rider perspective and when you're talking to the public and to your customers. In a little easier to read way, here are examples within those 4 categories. Again, we want people to be able to say they're pledging to this program by doing what it is they're doing. We're not saying you have to do X, Y, or Z, but we are saying as part of the commitment to the program, you should highlight what you're doing under protecting each other, what you're doing under informed decisions. An example for informed decisions are, some of the systems, say in Chicago, they've created either apps or kiosks that are doing real time, this is how many people are on the bus information, which technologically might not be something a smaller system can do. But if you're sharing information with your riders in the form of a newsletter or a flyer that says, we are limiting the amount of people on a bus, we are running more service so that there's less people on each bus, that's another way to do informed decisions that's not a kiosk with real-time information. And then the health and safety aspect, again, of what you're doing to keep your employees safe and what you're asking riders to do. Riders, if you don't feel well, please don't get on the bus. We're not going to have our operators driving if they don't feel well. We created one link, which I will actually jump into the comments section when we're done presenting here, that is a resource hub that has all of these commitments program elements that we're talking about, which are actual assets that we want people to download and use. We've tried to make as many of them digitally or socially applicable, but we do have print files that you can download and use yourself. The seal is actually in there as well. So if you go to this resource hub, you can grab up to, I think we have 120 or 125 different assets that we've created, and they kind of fall into these categories. The actual seal, we've done posters. We've done posters for bus stops. We've done posters for the inside of stations. We have several social media graphics that can allow you to run that kind of information regularly on your social feeds. We have a public-facing web page that kind of explains what the program is. It's the web address that's on all of these assets so that if a rider wants more information, they go to that page and then you can sort of augment that with what you're doing. We actually created some public service announcements that are scripts that systems can read and use. We've heard of a few places where they've got an operator with a great voice, so they've taken that script, recorded it with that individual's voice, and they've used that in their stations. We created some key messaging and talking points. We did a fill-in-the-blank press release. This is all on the website. And we have this toolkit webpage, which is where all the agencies can download assets. And this is just a little bit of a show and tell, but we wanted to visualize, as people are jumping in the system here, the program, where things can be shown. On the side of a bus stop, on the side of a bus, the back seat of seats inside of a rail car. And then we did different levels of posters. So if you don't want the super detailed, hard to read one on the right, which would be something maybe you put up inside your facility, the one on the left would be more public facing. It's got the very key points of what the commitment tenet is, and it has the imagery that people connect over time that, that mask is the cleaning and disinfecting pole of the commitments program. We also had the designers mock up what it would look like inside a bus, and then here's what it would look like on your tablet or on your laptop if you're looking at a Facebook post or a LinkedIn post. And I will say the biggest pickup I've seen in the month, less than a month that we've unveiled this program, is the use on social media. So I think it's the easiest and the most efficient way to get this messaging out about the program. So I encourage you to grab that off of the website. If you need me to send you a few sample tweets that we've done that you just want to share, or sample Facebook posts, I can send those along to you as well. This is just an example of what the public-facing page looks like. So this is what the posters would direct you to. And so this is just a little bit of information. What is the commitments program and what is APTA? Because not everyone knows what the American Public Transportation Association is, but they certainly know what you're doing on the local level as your agency to protect their health and safety. These were 2 examples that we did of recordings for PSAs. Again, they're really highlighting the cooperative effort between agency and rider. And if you hear this, it's that notion of we're putting health first. Please, before you come and ride with us, you put health first as well. The talking points that I talked about, broadly, the systems are committed to keeping riders and employees safe. Shared commitment between agency and riders. And transit is essential, and this was a key part of the task force as well. It's essential to recovery in our communities, for our nation. It's been an essential service during a really difficult 6 to 7 month period now where essential workers are using public transportation to get where they need to go. As communities begin to open up, public transit has already been running and will be there to take them to other aspects of life, entertainment, sports, libraries, but it's that we are going to play a vital role in the recovery of this nation and our communities, and it's going to be because we've dedicated our efforts to the health and safety of our employees and our riders. That is our slide deck. I want to say that Bill and I can take any Q&A now. If we want to do Q&A at the end of the session, we can do that. But I will make sure the resources go into the chat box here in a second, and I'll also send it to the organizers of the event as well.
And if I could just add, this is a tailor-made program if a system doesn't have some kind of campaign to inform riders about what's being done. And as the research told us, the more you tell riders, the more likely they are to come back because the more comfortable they are. But even if you already have some kind of campaign or system, we've been asked, can we use parts of it? Can systems use pieces of this? And the answer is absolutely yes. We want transit agencies to use any parts of this that they find can, as to use TJ's words, really augment and elevate whatever they're already doing. And we feel that having a national, industry-wide set of commitments will really elevate what folks are doing locally. I mean, Chet, the fact is, if you have your own program locally, you're certainly meeting these commitments in some way, shape, or form. And so why not take advantage of the seal and some of the messaging to really show that what you're doing really goes to an industry-wide national level of commitment.
All right, well, those were our speakers from APTA. Are there any questions? Maybe you can write them in the chat box before we move on to Scott. And not seeing anything, so I'm gonna still time if you find something you can ask at some point, but let's move on to Scott. And Scott, if you could just introduce yourself a little bit and go on to your presentation. Thank you.
Yes, thanks, John. My name is Scott Stark. I'm the Training and Safety Manager at St. Cloud Metro Bus. I've been in this position for approximately 3 years. And prior to that, I was an operator both on the fixed route and the paratransit side with a background in education. So I want to say thank you to TJ and Bill. I think those are that's good information. And I will definitely pass it along. I know, like you said, our marketing department has been doing those types of things, but I think having that industry standard documentation is a real benefit across the board because it sends a consistent message. So I'm going to try to share something here, John, and go through a quick PowerPoint. See what I can do here. Sorry. How's that? You see that?
We could see that, Scott, if you close on the right-hand side your animation pane. There's a little
My
X
animation
there.
pane.
Or
Yep.
go ahead and make your PowerPoint full frame. Thank you.
Is that better?
that's better. And then if you, on the bottom, wanted to click in presentation view, make her full frame, that would be a little easier to read on this end.
Sorry.
Scott, do you have multiple monitors?
I do.
I think the presentation is probably going to a different monitor that the then Zoom is picking up on.
All right, let me see.
So
if I
we're
can-
just seeing just the slides, not the presentation mode.
Okay,
This just gives you an idea. of
I'm gonna
what's
try to
going on.
change monitors then. No, not working here. Apologize. It worked before.
The next chart, you'll see
You're
continued
just seeing,
trends, and it gives you a little bit of an idea of how things change based on where they started. There was a special session bill that we had hoped would pass with capital investments, and you'll see.
If you
that
go into the presentation, are you able to access Zoom
as well as the passenger rail program?
once you're in presentation mode?
Minnesota Transit, for instance,
um,
down to 2 million.
I can see it now, the,
Hub was included, bus rapid transit state at 55 million.
Sorry.
Senate made it all the way up to 12.
did that change anything?
That's it.
Looks tremendous in Rochester. Thank you.
All right, thank you. Sorry about the delay there. All right, so I'm just going to approach this from our perspective for safety for our employees and for our ridership. I'll go through this kind of quickly. So one of the things that we've done over the last 3 years is we've restructured our training and safety department is to really take a hands-on approach and really start from the beginning. And that, what I mean by that is that starts at onboarding. If I could take a step back, one of the things that I'd like to see us get a better handle on is what our employees think of our safety program and what safety means to them. So that's kind of what I'm going to start out with here, is what safety means to our employees. And then how do you manage your safety program? And then just kind of look at what we're doing here at Metro Bus. So I just very unscientifically and randomly selected some employees and asked them, what does safety mean to you? And I'm going to share some of the quotes. I asked for just a very brief, a couple sentences. And I got a lot of text, a lot of words. And so I tried to cut some of it down without changing the message from all different aspects of our staff, from our employees, of which we have about 160 of. 100 of those are operators. We have about 15 maintenance staff, and then the rest will make up our administrative staff. So you can see as the messages are coming across, what was exciting to see in these messages, or these what people reviewed as safety, was some of the common themes that we've been trying to establish over the last few years, and just to make people aware of what's going on. So I'll just kind of buzz through some of these things. I apologize if my screen is dark. My lights have timed out here. So both from operators and administrative staff. They all see it as a team effort. They're all taking ownership in it. So the message that we're getting out there is really sinking in. Taking the time to do things, to be safe about stuff, to not being rushed. And that's one of our key components throughout our training, is that we don't rush to do things, even though we operate under a timed schedule. That even though the public expects that, and we really try to adhere to those time schedules, we're asking the operators to perform safely, and for everybody to do their job safely, and leave the schedule to fall into place. Conscious efforts, doing my job, knowing that I've been doing what it is to let me go home safely, taking a few extra moments to double check and make sure everything's right and not rushed. And then, the communication, the education and training, and making everybody aware of what's happening. They may not know what's happening behind the scenes, but what are some of the results that are going on out there, and what are some of the efforts that we have from a safety perspective that are keeping our employees and our passengers and the general public safe. So next, I'd just like to go quickly through what we're doing at Metrobus and how we approach safety. And it all really starts at hiring. We kind of changed our perspective from bringing experienced folks on that have had large vehicle experience to really looking at the soft skills. And if those people have the soft skills and are eager and interested in learning how to drive large vehicles, we'll teach them how to do that. So that's been a big change in our philosophy. It's a multiple person interview, and the questions have changed as well in regards to, are these people able to form an active thought that helps them manage situations. So we go through a number of scenarios through the interview and ask them how they would process what's happening on the bus or in their work environment. So hiring is really where everything starts in selecting the quality candidate. Next is our training. This is focused really on the operators, but along with the dispatchers, who are both in safety sensitive positions. You're looking at approximately a 6-week intensive training program that includes classroom, behind the wheel, in service, with revenue service. And once they're out of the training classroom, we don't forget about them. We like to do onboard visits at periodic times throughout their training, up to 2 years. And then once 2-year anniversary is hit, then we go to an annual onboard visit, and potentially are working towards doing even more of that as our schedules will allow. Not only that, but ongoing training with our entire staff. Right now, we bring in the operators in every 6 months for what we consider either operator training activities, which are really based on fundamental technical skills. Maybe a lot of redundancy there as far as performing how to drive the bus. But we've got a lot of feedback from our operators that have said that it's been good for them because it brings them back kind of to that center of the expectation where they have been getting away. If you're familiar with the term practical drift, we emphasize that a lot. The further you get away from training, the less likely you are to meet the expectations of the organization. And so we like to bring the operators in and refresh them on a regular basis. Organizational wide, we do what we call pods. And that's an annual thing, and it's our safety training. It's also other specific Metrobus things that happen. And then we also bring in an outside facilitator to promote a message that we think is beneficial. This year we did it back in August, and we were able to provide someone that to discuss or present ways for folks to manage the pandemic situation and how they're dealing with things both on a personal and professional level. And so we got some good feedback from that as well. Along with other random types of training that we bring in, all of our personnel for various customer service to model that professional and courteous service, because that's what the expectation is. And then it's always a way for us to educate and inform our personnel so that they can continue to educate and inform our riding public, which is really the end result for all that we're doing. As part of their training, we do some talk about work-life balance, and this gets into, excuse me, this gets into our current environment now, but we really focus on fatigue and making sure that you're getting enough rest. I kind of call it our return to 8th grade health scenario, and where we talk a little bit about nutrition and exercise and proper hydration. And then we also add on the proper sleep habits. And again, it's not something that we're forcing people to do, but we're trying to make people aware of how they can be more responsible and help them function better at their responsibilities. And that's across our organization. Everybody talks about that, or we all talk about that. Along with that work-life balance, things happen. Our people have kids and they have a life outside of work, and we want to make sure that through scheduling and through working things out so that they're able to enjoy life and enjoy coming to work, and just overall have a rounded life so that they're performing at their top whenever they can. We have started a well-being program back. It's been approximately a year now that we try to, again, keep healthy things in front of people, whether that be simply a message on eating right. We provide healthy snacks every other month. We do a lot of promotional signage. We had a walking challenge over the course of when we were reduced service under the COVID process that we went through from June until August. We have 212 miles of fixed routes, and so we challenged people to get out and walk the 212 miles, and it was well received, and was a good way to kind of keep people engaged throughout the summer. So we also have a well-being library, and then just some examples of what we do for the months. And then as this is every month, we're updating the calendar and changing things and addressing things. For September, we just had an activity that was simply a household scavenger hunt. Again, just to keep people active and engaged, and trying to create some fun things to do at work. We do a few other things company-wide, do some softball for those people that enjoy those types of things. Bowling is on the agenda, but both activities in this case, given our current environment, have been postponed or modified. So hopefully when we get back to a normal, we'll be able to get back to some of those activities. And we encourage people to come and watch as well too, even if they don't want to participate, because it's good to get together and have that social interaction. One of the last things here that I want to talk about is the technology and just our adaptability to current environments. Just to kind of coin an old phrase from my education days. We used to talk a lot about modifying and adjusting. So as things change, you got to modify and adjust to what you're doing. So some of our buses are we're equipped with partial environmental barriers. With the pandemic situation, we've now gone to more of a 2/3 type barrier, and I have some pictures here that I'll show you. Again, safety perspective, some of our buses now come equipped with 11 cameras. We've upgraded our radios to a high frequency digital radio, Armor radio system. So we've got good communication. We've got AVL location systems on our buses, and then silent emergency buses or buttons on our buses as well. Some of the things that we've adapted to as the pandemic situation has progressed, cleaning the buses more frequently and on a regular schedule, and now on a daily basis. We've established sanitization with the what I like to call the Ghostbuster pack, which is this electrostatic backpack sprayer. Maintenance guys can sanitize a bus in under 60 seconds, and so we've added that to our regimen. And then the barriers that I was talking about before in our fixed route, if you can see it here in the middle, it's a clear shield. It's about a 2/3 barrier. It comes down just to about seat base level, and it slides open for when passengers are alighting or getting on the bus. And then when the bus is en route, it stows in this position. So we've incorporated that into our fixed route buses as well. And then lastly, communication, kind of on the same lines that TJ and Bill were talking about. Communication is huge, and keeping people in the loop. Again, they might not know some of the what's happening in the back room, but to let them know what's happening with the time in between preventable accidents. In 2018, we instigated our digital accident-free sign. So just to communicate that, and it helps to generate a little competition, friendly competition amongst the operators. And then we do have a monthly newsletter that includes a lot of stuff from a lot of different departments, but there's always a section there on safety. And also what the accident report was for the previous month. So that's kind of what Metro Bus does to maintain our safety protocol and keeping our employees safe. And it does have results. So these are the results for the last 3 years. And as you can see, our actions have produced results. And I was just given fiscal year 20's results as well, and it went down another 10. So we were at 22 preventable accidents for fiscal year 2020. Obviously, we had less mileage, but still, it's showing that what we're doing is responsible for change in the preventable accidents that are out there. So that's a good sign. And our employees are taking heart to it and are buying into what we're doing from a safety perspective. So I'll leave it I know we're going to have questions and comments at the end here. So with that, I'll turn it over,
Scott,
and thank you.
Scott, there is one question specifically for you, and that's have you ever used or thought about foggers for bus sanitation? So I know you touched on the sprayer, but how about a fogger? That's from an anonymous.
I have not been part of a conversation in regards to that. The conversation was with the sanitizer, but I've not we have not discussed the fogging part of it.
Okay. Well, thank you on that. Very nice presentation. And our final panelist is Captain Brooke. And oh, did I get another one here? Captain Brooke. And Captain, if you could introduce yourself, a little bit of your background, and then do your presentation.
Good afternoon. My name is Captain Brooke Blakey. I'm with the Metro Transit Police Department here in St. Paul, Minnesota, Minneapolis, St. Paul, Twin Cities. And I was asked to come and speak about our homeless action team, which I'm not quite sure how this fits into safety and security, but I think maybe because I'm part of the police department, that is kind of what they wanted me to talk about. And I think that's more about perception of safety and security on transit systems. And so I'm going to talk a little bit about a new initiative that we have here at Metro Transit Police Department, which is called the Homeless Action Team. And it's one of those things when we talk about how do people feel safe and secure on our buses and trains. One of the things that we have seen here in the Twin Cities, as well as starting to be in our local suburban areas as well, is individuals utilizing transit for its unintended purposes. So using our transit centers, buses, and trains for places to sleep. So I will fire up my PowerPoint and we'll discuss what our our homeless action team is all about and go from there. And then I'll answer some questions. I'll keep it very brief, and then I can answer any other questions as we talk about, as I was listening to everybody else's presentations, I'm like, I think somebody else should probably have been doing this, could tell about the foggers that we're using and our COVID practices that we put into place and all of those things, because we do have lots of those things happening here at Transit. But I will give you my presentation. I'll make it quick, and then I will answer any questions going from there. So let me share my content here. Hopefully I have it right.
We are very pleased to have you here, Captain. So.
Okay, I'm going to try this again. Here we go. PowerPoint. Okay. Is it sharing the screen or no?
They are looking at
Not currently.
Okay, hold on a second. Let's see. Share content. Share screen.
And so one of the things that we've done was a lot of work to help reduce congestion.
Keeps wanting to share my
Market to individuals.
Zoom. I don't know why. I'll try that.
Public transit. And those are the riders of choice. And the riders of choice are likely to be the last ones for two reasons. A large number of them aren't going to their offices downtown, and they're all working remotely.
It's not sharing the content of my screen.
Do you have multiple monitors that you're using?
Nope, I am on an iPad.
Ah, okay.
Do you have your PowerPoint open?
I do have the PowerPoint open. So when I hit share content,
Some
I just hit
options.
screen and it says Zoom. See if it does that.
To increase ridership and to continue to work for funding. The worst thing that can happen in transit.
There we go.
There it is.
All right, there it is.
Is a reduction in funding for transit due to low ridership levels. Because this
Alrighty. So this is our challenge that we have with our current issues here with Metro Transit Police Department. What we have found is that the police department generally receives calls from customers and operators about individuals that are utilizing our transit system for housing and its unintended purposes. So one of the things that we have decided to do is we created an initiative called the Homeless Action Team, which works with our operators, our drivers, and customers to help the police interact with individuals that are experiencing unsheltered homelessness. What we found in the last few years is that the cost of this, including our emergency room, jail detox, and then the cost to transit for cleaning and other purposes have risen in cost. And so we had over 2,700 calls in 2018, 2,000 in 2019, and we are about at 2,700, almost 3,000 for 2020, even though we are experiencing COVID. So what we created was the Metro Transit Homeless Action Team, which basically really addresses customer service complaints, community concerns about health and safety. And one of the biggest things that we have seen during COVID is a lot of the homeless shelters and other places that individuals generally occupy during the day or overnight have been closed due to COVID restrictions. And so we're seeing a lot of more individuals located on our transit system, so buses and trains. And so how do we keep our community safe and healthy in the middle of the crisis of COVID? And so what we have done is we've created a mobile assessment vehicle, which is probably one of our pride and joys. And what that allows us to do is transport individuals that are currently utilizing basic transit and utilizing a reconditioned Metro Mobility bus to get individuals to local shelters that are still currently open and participating in getting our unsheltered individuals off of the street. This is the inside of our mobile assessment vehicle, and what it allows us to do is to cater to our unsheltered homeless individuals. We have Healthcare for Homeless, which comes in and does all of the different healthcare remediation things for the individuals, deals with crisis intervention, deals with outreach and connecting individuals to shelter space in those overnight hours. It's also has capability of accessing the HMIS, which is the Homeless Management Information System, to connect individuals to homeless resources and outreaches. We have the ability to create temporary IDs for individuals, which is one of the biggest barriers of individuals experiencing homelessness. And again, like I said, we have the ability to work with Healthcare for Homeless, who provides some trauma-informed interviewing, deals with addiction issues, gets those individuals that are experiencing those into current placement spaces. And it's one of those things that we've also been able to provide Narcan training for individuals on the street and provide harm reduction products to those individuals. This is a suggestion of one of the biggest things is getting information and identification to individuals. So we are currently working with the Department of Public Safety to be able to give IDs out to individuals that are struggling to get identification to take the next steps into getting themselves out of homelessness. It also makes them eligible for our transit assistance program, which is TAP. And so that's one of the other things that we're definitely proud of. With that, we have then also partnered with our HRA, which is our Housing Redevelopment Authority. And so we have 89 housing HUD vouchers that we are placing people into federally rent-assisted homeless facilities, as well as permanent long-term housing. We also have options for beds at our winter safe space, which is now considered seasonal safe space, as due to COVID, they've opened it year round, which is a low barrier shelter, so we can get individuals out of our transit centers and off of the trains and buses overnight. And so we are also providing outreach for the pre and post moves to make sure that the housing stability of these individuals are still staying connected once we get them off our trains and on our buses and into stable housing. This is what seasonal safe space looks like. During COVID, what Ramsey County and Minneapolis have been doing is utilizing other open businesses where individuals are no longer working and turning those into homeless shelters. Just as recently announced yesterday, Ramsey County took over Bethesda Hospital, and they'll be adding an additional 100 beds into that facility. Really, what I really thought I was going to do is ask a lot of questions or answer a lot of questions in result to how COVID has affected our drivers and how do we keep our riders and customers safe with our unsheltered population and transmission rates. And so I can say that We've been really successful in getting individuals into safe housing components and places. And we have used our different our mobile assessment vehicle to move people to and from, but we've also came up with COVID practices to make sure that we're handing out masks to our unsheltered individuals, as well as drivers and anyone else occupying buses and spaces. And we've changed our process in how we do fare inspection to make sure that we're keeping drivers and operators safe, as well as our unsheltered population who generally don't have access to medical care. And that's all I have as of right now.
Okay, well, thank you. It was good presentations, a lot of good information.
Okay, there you go. I'm sorry.
Anything else on that? Or if not,
I do not. I can answer
okay.
any questions.
Okay, are there any questions for any of the panelists yet? Any other further comments from the panelists? Any other impressions or comments that would like to be made? Well, as I anticipated, we're a little bit early with the session finishing up. I know I'm going to certainly share this information with my systems and tell my colleagues about the information that was here today. And I thought it was very, very beneficial, kind of a proactive approach towards dealing with scenarios, not just reacting, but also being proactive. So I really appreciate that. I appreciated the statistics and the information that was gathered from APTA, and then also the challenges that it looks like Metro is facing at this time too. So unless there's anything else, I'm keeping it open here, but if not, I believe that's it, and I'm not quite sure how to close this out, but in-house media, do you have anything else?
We're live in Rochester. We've got, looks like there's no questions from the Rochester room either. So
All right.
a lot of good information was covered.
Good to see everybody. Bye.
Thanks, John.
Yep.